Hello, I'm Dr. Ranganadam, neurosurgeon, SLG Hospital, Bachpalli, Nizampet. Today we'll speak few aspects of the noise pollution. All of you are talking about atmospheric pollution, air pollution, and all that. People are not recognizing that noise pollution is also no less dangerous. Now, normally the amount of noise that is permissible for an adult is around 80 decibels. Decibel is a unit for expression of noise. For young children or young adults, it's around 75 decibels. Now imagine that when the decibel percentage increases, what happens? Now we are seeing people are on roads with their personal listening devices like smartphones, headphones, earbuds, hearing buds. So all these gadgets are newly coming into the market. They are good, the people should enjoy. But at the same time, they are not realizing the danger associated with that. Now the dangers or the problems associated with noise pollution are two. One, we talk about auditory. Auditory means something related to the hearing problem. And the other is non-auditory. And now first we'll talk about the non-auditory. What is non-auditory? When the sound permissible limit crosses the limit, the brain suddenly gets a jerky feeling. And there is a very important structure in the temporal lobe of the brain called amygdala. And amygdala reacts. It sends a stress signal to hypothalamus. Hypothalamus is the area which controls important functions like the temperature, the reaction, the ability to react to a situation, all that. And hypothalamus sends signal to what is called adrenal gland, which is located on the kidneys. It produces important hormones called adrenaline, stress hormone. And the moment a sound, sudden, noisy, unexpected sound comes, it floods into the blood. And as a result, the blood pressure rises, the heart rate rises, and sometimes the heartbeat can be regular also. Now, if it's for one time, it's fine. But it's the same thing continuing for many days and many months and all. Imagine what will happen. What will happen? The brain is a casualty. From the ear, the brain is, the sound waves go into the brain and the brain gets what is called a vascular damage. The blood vessels of the brain gets damaged and also there is an inflammatory reaction, there's swelling and damage to the brain. As a result, the sound that is producing what is called anxiety, depression, increased blood pressure, increased stroke, and also heart attacks. It may sound a little bit silly, but these are all proven scientific facts. Now the other side is there is what is called cognitive disabilities. What is cognition? Cognition is ability to learn, ability to communicate, ability to communicate to other people also. These skills are also getting distracted. So brain damage with the sound is a known fact. It produces hemorrhage into the brain. It can produce a surface of the brain also damaged. So the lesser the high decibel usage of the gadgets, the better. Now the WHO estimation is that the number of youngsters going to develop a deficit in the hearing deficit in the next few years is anything around 1 billion. And these are the future of this any nation. Now imagine when a youngster's hearing difficulty comes and he cannot be actively participate in the day in and day out activities, that's a very sad thing for any nation. So sound, enjoying music, festivals, everything is important, but at the same time there should be a limit. And suppose somebody using headphones, fine, but there should be intermittently, they should give a break, maximum 10 to 15 minutes in between, not crossing that. The longer the sound damaging into the brain, the longer the problems, and it will be very, very detrimental damage to the individual. Thank you.